guess what? It's time for Cleared to Play. Can take you inside the tent. Get you updated on the latest injuries in the Bay. Proud to partner with UCSF Health on this segment and bring in Associate Professor of Orthopedic Surgery, Dr. Nirav Pandya. Hey, Doc, how you doing today?
I'm doing great. How are you guys doing?
We're doing great, man. Like, you're not going to be a crazy person and join this 95-7 the game basketball team and end up tearing a ligament, are you? You're not doing that. You know better than that. You're an ortho. You know not to do that.
You know, there's always room for a 5'6" point guard out there. Someone needs to give Guru the ball because no one's going to pass it to him. So I got to be there for him.
Like, will you corroborate this? I had a buddy of mine who's an orthopedic surgeon also who told me when I got hurt playing hoops like 8 years ago, he goes, my office is a line of dudes your age still trying to play hoops.
Yeah. It's the 35 and over, 35 to 50-year-old male. It's just a setup for injury, yes. And I fall in that group. So we all try to relive our glory days and then end up in the office. That's totally true.
Yeah, both of my catastrophic injuries, Doc, came from the sport of basketball, the torn ACL and the torn labrum. So I'm glad to hear Mark, a little bit younger than me, take the smart route and decide to pull the plug. One player who's looking to get back on the court, Tyler Herro, tonight. What could Heat's fans expect from Tyler Herro if he's able to get off the questionable list and play with the bum hand?
Yeah, I think it's going to be tough for him to be impactful. I mean, I think it's been almost nearly 6 weeks now since his injury, and it's a shooting hand, and it's hard to simulate those live game settings, particularly touch and three-point shooting for someone in his position. So potentially there could be limited minutes, see how he's out there for 5 to 10 minutes and see how he's flowing with the rest of the offense. But I think it would be hard for him to be impactful and score 20, 30 points a game. But just where they are right now, they need any kind of spark. But I think with hand injuries and three-point shooting and playing at the guard position, it's going to be hard for him to be really impactful, but maybe he'll be able to change up a little bit of their pace and provide some support for some of the other players.
Doc, we were just having a conversation about 15 minutes ago about this kid, Quinn Matthews. He is a pitcher for Stanford. He threw 156 pitches in the game yesterday. I think Stanford is nuts for letting him do it. Absolutely crazy. When you hear that, what do you think?
I think it's a great question. I think it's a combination of factors. I think in collegiate baseball and in the majors, there haven't been good studies that shown that one huge outing can lead to injury risk. I mean, you definitely see that in kind of youth, like Little League areas, where one outing can kind of increase injury risk. But I think where you get a little bit more concerned is not necessarily the pitches he's throwing in that game, but that longitudinal volume that he's having. I know Dan was talking about how many pitches he's throwing and how much that lead up into 156 wasn't necessarily that big a jump. But that's still a lot of pitches he's been throwing throughout that season, and that begins to add up, and how much he's warming up and how much he's cooling down. So I think in general, the reason why they don't do that in the majors anymore is that there is kind of a longitudinal injury risk that comes from leading up to that. One game potentially maybe does not do that, but I do get concerned more bigger than that is what message that sends to kids who are playing at the lower levels that, hey, you're going to get glorified for throwing these many pitches, and suddenly have a bunch of 10, 11, 12-year-olds trying to throw 140, 150 pitches out there. So it's a little bit more complex than just that one individual pitch count, but definitely I think that what led up to it and the kind of the longitudinal nature of it increases the injury risk.
Luckily, we do have those protections for youth players to where they're forbidden from throwing that many pitches. Does days of rest play a factor in just how damaging this can be, and also something non-numerical, Doc, like just the basic fundamentals and the body type of the pitcher involved?
Yeah, I think, rest does play an important role, particularly if there hasn't been necessarily an injury occurring to the UCL. One thing I tell pitchers is that, the more you're pitching, the more likely, particularly when you're fatigued, you could have that traumatic injury or some sort of partial tear that leads you to then go on and tear it. If you structurally stay okay, then you are worried more about muscle fatigue that could then lead to mechanics breaking down and that injury risk. So absolutely, barring some degree of structural injury, that rest will help. And also, you're absolutely right. There are some pitchers whose arms are able to hold up to more of the volume. But I think more importantly, it's not just necessarily how they're made up, but it's how much pitching they've done when they're younger. I mean, people bring up this Nolan Ryan example and the Jamie Moyer examples. These kids, when they were kids, they weren't throwing 130, 140 pitches and playing year-round baseball at age 8, 9, and 10. So they were able to extend their careers and throw more volume when they're older. So I think the comparisons to back in the day are not the same as what we're seeing with current pitchers right now.
Doc, your confidence level in Brock Purdy for week one has done what in the last month?
I think it's gone up. I think the fact that he's throwing and seems to be kind of progressing really well. I think there is that possibility for him to be structurally ready for week 1. I think what the decision is going to come down to is they feel they're willing to take that risk from a football standpoint. I think he'll be cleared. The question is, are the 49ers going to be willing to say, look, let's give him a couple more weeks and see how the backups are going to play before putting him back in? But it does seem that he's going to be ready for week 1 based on the progression that the team has been reporting. Which
is good news, and maybe bad news if you're Trey Lance, but good news certainly for Brock Purdy. Jimmy Garoppolo, the ongoing questions about his injured foot. What's the next hurdle for Jimmy G in terms of getting better and being able to show what in a physical to be able to get his contract made whole?
I think it's a combination of factors. I think number one, none of us quite know exactly what the surgery was, but I'm assuming that it's some sort of issue with the bone and the ligaments in that area. I think number one, he has to show healing on the X-ray. That's probably what the number one reason was why the Raiders didn't necessarily seem that concerned about it. I think they probably got a physical, saw these X-rays, and said, hey, this needs to get fixed. The fact that they're talking about him being ready for training camp probably means the first step for him is to get out on the field and be practicing. If he can be out there, potentially not in a boot, out there playing and not having pain, it sounds like he's going to be ready. The fact that they think a 3-month time frame from surgery to him being out there is pretty realistic means it's probably not a big deal. But once again, if there's any kind of backlog in terms of how he's healing or any pain, then they may just say, you know what, this is not worth our risk because we don't want him to have a secondary surgery, and we're going to move on to another quarterback.
Doc, I know that normally doctors like to examine patients by seeing them in person. We're wondering if maybe you could just listen to this and then diagnose Yankees broadcaster John Sterling over the phone.
Now the 3-2 swung on, a pop foul back here. Ow! Ow! It really hit me. I didn't know it was coming back that far. So once again, it'll be a 3-2.
Okay, so what 3 ows to you means what, Doc?
That means kind of ball hits head hits something else, and then he hits another person. So that's usually not a good sign for someone his age. So you do worry about a head injury, especially with his elevated age as a broadcaster.
Yeah, okay. All right, we'll pass that along. Doc, thank you very much, and we'll talk to you again next week.
All right, take care, guys.
There it is. The proceeding was sponsored by UCSF Health. Who knows? Maybe Steiny was right. Doc sounded concerned.